Hey there, I wanted to share some information with you. I just got back from a conference in Dallas, Texas, and it was put on by a company called Cellcore. And this was like their big yearly event where they had thousands and thousands of practitioners. I think there was 2,000 practitioners live in attendance and a whole host from all over the world attending online. And I was one of the fortunate ones to be there in person. And so I thought I'd share some of the key takeaways in a bunch of emails and videos like this. I'll try to keep them short, but I wanted to share them because even being in healthcare, sometimes you get shocked at the state that which we find ourselves in when it comes to health and how much of a need there is for people who can drastically change people's lives and help them get their health back. So in this video, I want to talk to you about fertility, what's going on with fertility, and what the traditional solution is and what it's going to continue to be because it is what it is. The wheels are big and that machine is going to keep plugging forward. But, and then also give you a solution or a direction that makes a lot more sense um, in that we can utilize to kind of get the momentum back into the favor of humanity. Okay. So, what I'm going to talk to you about today is fertility, and my first slide really says optimizing fertility in an infertility epidemic. So the first thing I want to talk to you about fertility rates. So since we have records of this, but from 1950 to 2024, okay, to this year, we've seen a decrease of 57.35% in fertility rates among women. Okay, this is unbelievably shocking how low our fertility rates have gone. So we've gone in that time in 1950s, the average woman would have 3.454 children. Now we're at 1.4 births per woman. Okay. So if you saw this on a graph, it looks like a complete die off. And believe it or not, North America, most countries follow a similar trend, but North America is somewhere at the bottom in terms of the worst. Okay. So this is affecting us. This is a global kind of statistic, but it's not just happening in, poor countries or something else. This is happening in the developed world. It's happening here right at home. Now, the big thing that we have to keep in mind here is if you're going to deal with fertility or you're going to help people try to conceive and have a child, the key here is you all have to look at two components, the female partner and the male partner, right? And so here's some statistics and some data on the men. So there's a study here on PubMed that says evidence for decreasing quality of semen during the past 50 years. Okay, so I'm going to read what they say about the average sperm count. So it says there's a significant decrease in mean sperm count from 113 million, okay, per milliliter. That's how many sperm are in a milliliter in the 1940s to just 66 million in 1990. And that's 1990. So that's not even looking at um, all the way up to 2024. Okay. So they also see a seminal volume go from 3.4 milliliters to 2.75. So the sperm count's going down and the volume being produced is also going down. Okay. This indicates an even more pronounced decrease than in sperm production than expressed by the decline in sperm density. So what we're seeing here is a genuine decline in semen quality over the past 50 years. So what is happening here? What is causing this? And are we sure that doing what we typically do? So here's what we typically do um, is just do IVF or some other form of medically assisted fertilization. And so the rates of IVF in 1960 were somewhere around 36.4% and has gone up to 76.2% by 2012. Now, something about me, I have 4 children. And one thing I noticed is many of my peers, many of my friends, when it was time for them to conceive, struggled with having children. I would say at least 60 to 70% of the people I know had to do IVF to have a child if they were lucky enough or fortunate enough to end up having a child. So shocking rates, but it matches the statistics we're seeing. Okay. And again, this applies only up to 2012. So it's already 12 years old data, okay, that we're seeing, but it's gone up the use of IVF to 76.2%. Now, is this smart that we're using this? So some of the things we should be cautious about is that we see in studies that children born from IVF have a bunch of things that go wrong. One, they tend to have lower birth weights, higher glucose levels, higher blood pressure, and higher peripheral fat, body fat. And so we're seeing that these are all markers we would use to say, it might be born normal, but not as healthy as the children who are born naturally. Now, here's the thing, okay? What we really have to be cautious about is when we conceive naturally, it tends to be the healthiest sperm carrying the healthiest genetics is the one that's going to get to the egg. And the egg should be the healthiest egg, right? Now, here's the thing. We used to believe that it just used to be the speed, the fastest swimmer would get to the egg and impregnate the egg. But what we're now starting to learn is the egg is actually going to select which sperm it's going to allow in. It's not just a process of who wins the race. And so now that we're taking a sperm and if our sperm are decreasing in quality, right? Meaning they would never even get there if they won that race anyways. But now we're taking sperm with genetic issues in them and we're injecting them into the egg. Now the selection process, we're taking over that process, which probably isn't that smart. What we're seeing is there's an increased risk of epigenetic disorders, congenital mutations, chromosomal alterations, and even subfertility in the babies born following these processes. So this is kind of wild. What we're seeing is these kids that are born through these processes, this specific process in this study is called ICSI. Now, if they're born via that process, what's happening is those genes aren't being we might be able to conceive, but we're conceiving to kids that might end up being or might end up struggling with more fertility issues than the mother and father were having already. And so where does that leave us as a species? Is this the right thing? Should we be doing this? And so how do we solve the problem? What we need to do to solve this problem is first we need to understand that you cannot fool the body into being ready to carry a pregnancy. And so we can trick it momentarily with hormones. We can fool it with injecting a sperm into the egg in conceiving. But does that mean we're making the best decision? Does that mean we're getting um, does that mean that we're getting what we're really asking for? Because typically when we want to get pregnant, we're not asking for just any baby. We're asking typically once someone conceives, the concern is I hope I have the healthiest baby, the strongest baby. I hope my baby does well and thrives. We're not really looking to just conceive only for that child to struggle, right? So number one, we have to understand fertility is a reflection of your overall health. And your overall health is always a reflection or is impacted by the environment. And the environment consists of many things: your air quality, your water quality, the people around you, where you find yourself situated. All these things make up our environment, and this impacts our biology and our health. We also need to understand that something like infertility isn't really an illness, it's a symptom. And it's a symptom of something much larger going on. And the outcome of that symptom is you can't conceive, you're not having success having children. And so, what we need to understand is these symptoms are clues or messages that we need to understand this language so that we can start coming up with solutions for these people. And oftentimes, these solutions are going to be completely different from one couple to the next. And so, to get to the solutions, what we need to do is uncover what is preventing people or preventing the body from healing. Okay. And so, in this area, what I would call is hidden stressors. Okay. So, we know what your obvious stressors are, things like your work, your job, your relationship, even the stress of trying to conceive, right? That's a stressor, but it's an obvious stressor. Hidden stressors are like, what kind of toxins do you have from your environment that we know diminish fertility rates like really significantly. And so things like toxin exposures, what's being accumulated inside you, what's your stress levels like, what's your sleep like, do you have stealth infections, do you have mold infections that could be suppressing your ability to reproduce? All these different categories need to be investigated. And when you start digging through this personalized way of investigating someone's health, then what you can do is you can create a solution by figuring out what combination of these factors is present in that person. Now, when I say person, I should say persons, because when you're working on fertility, it's always the, the female and the male, never just the female. This isn't something we can push off. Remember what I said about sperm quality and production is that has dropped off the face of the earth in most men, okay? Now, what we have to also understand is this journey shouldn't just be about trying to conceive and then you won. It should be about what I would recommend if there's a couple looking to conceive and they wanted to make sure that that child was optimally healthy, then we have to make sure mother and father are optimally healthy. So that couple should spend at least 6 months prior to trying to conceive, getting their health in optimal tip-top shape. That would mean investigating those things we talked about, toxins, mold, all these different things, okay? Um, then if you conceive, you have to support the pregnancy. So then there's certain things we should be doing to work on our health during that pregnancy. And once that baby comes and is born healthy, what we need to do is support that mom postpartum in certain particular ways to make sure that her health stays so she can take care of that baby, to give her a chance and not go through postpartum depression and all these other things. So you see that what we typically do is just work on the woman or the male if we do ever test them for sperm issues. But what we have to do is work on this as couples, okay? And we need to get to the root cause of this problem by investigating these unique factors that are all, and believe it or not, we all are exposed to these toxins. And you have no clue how high the level of toxins you have in you are because no one's ever tested you, okay? But they're ubiquitous, they're everywhere. Everywhere in our environment, we're exposed to them. Then we got to support these three phases: preconception, pregnancy, and postpartum. Okay. Now, when we do that, that gives us a shot, that gives us a chance to tip the scales back in our favor, to get this fertility or infertility crisis to start going the other direction. Okay. So it really requires the right ingredients to, and to make this recipe, to make this fertility issue go away. And so what I wanted to give you this video so that you can kind of see the disparity between what we're doing at like the doctor's offices when it comes to IVF or these other medically assisted fertility treatments, as opposed to what we really should be doing and what we should be investigating. This is always going to be a journey of how healthy that individual is and what we can do to optimize that. So I hope this video helps you. I know that when I was learning some of this stuff over the course of this conference, I was kind of blown away at the statistics. Um, and I think that maybe I was just lucky at that time in my life. I was already going through some of the changes I ended up making, and I was getting into functional medicine. So I was already, on that path of trying to optimize my health. And that we were really lucky to be able to have 4 children. And that doesn't mean there wasn't problems along the way, right? And so my heart goes out to every single one of you. If you're trying to get pregnant and you're struggling, don't give up. You got to look for answers, and you got to look for the answers in the right places. And I hope this video kind of gives you some direction as to where to look. And if you need help, I'm here for you. I hope this video serves you and you enjoy watching it, and most of all, I hope you learn something. I'll talk to you soon, everyone. I'm Dr. Binning from the Functional Health Institute. Make it an amazing evening. Bye for now.